All right, here we go. Hello, and thank you for watching this webinar on new patient processing and how to maximize reimbursement. There's no audio taping allowed or videotaping allowed, in any unauthorized reproduction, dispensing, forwarding, or copying of this webinar is illegal. It's not intended to be legal advice. The information contained in this presentation is for educational purposes. It's not supposed to substitute your thorough clinical decision making. Target coding does not engage in providing legal services. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going. My name is Dr. Marty Kotler, the president of Target Coding. I'm a chiropractor. I'm also a certified professional compliance officer. I'm a certified billing and coding specialist. My areas of expertise include compliance as it relates to coding, billing, Medicare, Hipaa, not only for chiropractors, but for physical therapists and acupuncturists. And I take a little bit of a unconventional approach towards coding and documentation and compliance because, look at it this way. Most chiropractors are not certified coders. Most certified coders are not chiropractors. So I could take this unique approach and give doctors, when I go to their offices and when I speak to them on the phone, I can give them solid clinical information and then also give them some coding advice to make sure you're maximizing reimbursement. We'll make sure that you're not leaving any money on the table, especially with today's presentation, which is about maximizing reimbursement. I've written many training manuals on coding and compliance. I contribute articles to many publications and journals throughout the industry, and I'm a guest speaker at many state association conferences nationwide. All right, so let's begin with a brand new patient. Most new patients come to your office through a telephone call, right? That's the first thing that most patients do, is they will call you to make an appointment. So here's just a few key points. You want to gather as much information as possible in the shortest period of time. You may not need to gather everything. For example, do you need to get the patient's chief complaint? That'll be whatever works for you, right? That's what I do. When I talk to my clients, I ask them, out of every 10 patients that call to make an appointment, how many actually show up in the office? My feeling, it should be 90%. One patient might be shopping around, they don't show up, they space out for whatever reason, but I would say at least 90% of the patients that call to make an appointment should show up. If that's not happening, then there's some sort of communication gap that's occurring with the patient and the staff member. Even if you're out of network and a patient says, hey, are you in network with my plan? Staff should be trained on how to be the bridge. That's what I call it, be the bridge. Your staff, your front desk assistant, should be the bridge from the patient to your office. So what are you going to ask for? Email, phone, address, maybe the chief complaint. Guide the patient with choices. Mr. Jones, would you like to come in today or tomorrow, morning, afternoon, or evening? You want to make this professional, quick, and simple. How do they find out about the office? If they were referred to you by another patient, make sure to contact that patient that referred you, a new one, and thank them for it. Is your staff trained on how to handle shoppers? Sometimes patients that are looking for a chiropractor or a physical therapist or an acupuncturist, they'll go to their provider directory. And what do most people do? Most people will try and find a provider that's geographically convenient. So most patients looking for a doctor will try and find one, if possible, as close to their home or their office. So you could have a patient open up the provider directory looking for a chiropractor near their residence, and there could be 2 or 3. And now this patient could be shopping around. How does your staff handle shoppers? Do you discuss money on the first phone call? Most doctors nowadays do to have their staff talk about money on the very first phone call. But I work with some doctors, they don't want their front desk receptionist discussing money at all. They don't want to talk about insurance. They don't give out fees. Again, whatever works for you. In my opinion, what works best is Talk to the patient about money right on that very first phone call. And you know what? Nowadays, if you don't bring it up, the patient will bring it up. They'll say, do you accept my insurance? Are you in a network with my plan? How do you handle that? What happens if a patient says, are you in network with Aetna? Is your front desk assistant trained on knowing every plan that you're in network, every plan that you're out of network? Sometimes patients call, they go, you know what? How much is my copay? I want to know over the phone before I even come in. My recommendation is to give a range. And as far as, ask patients asking, well, how much is the first visit going to cost? Patients should realize that your time is valuable. The more time spent with a patient should equate to getting paid more. Well, at least that's the way it should work. Some patients may want to know their coverage. If you bring up insurance, they may want to know the coverage before they even come in. So here's a form that we recommend our clients that don't have receptionists that could enter the information into the system in real time while they're talking to the patient on the phone. So we have this little new patient phone call intake form. It's a little reminder. It's very good, especially for new CAs. They stay on track. A new patient calls. This piece of paper is right there by the front desk, and the front desk assistant is going down the list of questions. Good little reminder. All right, now, new patient shows up. Patient comes in. Hello, Mr. Jones. Welcome to the office. Okay, now what? You know the deal. Forms. Patients have to fill out forms. Doesn't matter if you have ChiroTouch, ACOM, Eclipse, Genesis software. Doesn't matter. There are still paper forms that need to be filled out. In some offices, there is more forms than others. I like the doctors that I work with that are trying to go as green as possible. A new patient calls up, you could have them go to your new patient portal if you have certified software and fill out all the information before they come in. That's ideal, in my opinion, but most of the time, got to give the patient a clipboard. Nice look, make sure your forms look professional. Remember, this is the patient's first entree into your practice. They don't see the doctor first. They're talking to your front desk assistant. They walk into the waiting room. Does your waiting room look nice and clean and professional? Your forms look nice. Patients have to fill out forms, financial policy forms, authorization to release information, authorization for assignment. Hey, if you're a cash practice, listen to this. If you're a cash practice, do not have the patients sign the assignment of benefit box. That's box 13. Because you don't want the checks coming to you if you're a cash practice. Patients paying you. I mean, at least that's my opinion of a true cash practice. Patients come in and are paying the doctor right at the time the service is rendered. And now if the patient has insurance, the doctor and staff submits the claim or gives the patient a walkout receipt. And the goal here is to get the checks to go to the patient. So why would you have the patient sign the assignment of benefits? Doesn't make sense. Lien, letter of protection, if you're in lawsuits, want to get all the forms out of the way. Consent to treat minor, hardship forms, outcome measurement forms. Get all the forms out of the way. There's a whole bunch of Hipaa forms, not necessarily, well, you see them on your screen. There are 23 Hipaa forms that we find very important when we go to doctors' offices. We read their forms. Believe it or not, there are doctors that are giving out forms that they haven't read, the staff hasn't read, the patients aren't reading. There's one. You see the Hipaa Notice of Privacy Practices. That's that new patient. Every new patient should fill out that Hipaa notice. Well, I was working with one doctor, sends me his forms to review. I'm reading his Hipaa notice. I guess he never read it. Staff never read it. Patients aren't reading it. I'm reading it. And there's a whole bunch of dental information in this Hipaa notice. I asked the doctor, where'd you get this? He said, oh, wow, my brother-in-law's a dentist. I just took his. You know what we call that in the industry? S&E. It's called silly and embarrassing. Get your forms up to date. Make sure they make sense for your practice. So get the forms out of the way. Here's some nice, intake forms, review of systems form, assignment. If anybody would like this form, There's quite a few forms I'm going to be showing on the screen. If you're a member of Target Coding, you get all these for free. If you're not a member of Target Coding, we're giving out a few. We're giving out this one, the authorization for assignment and release. So if you would like this form, just send an email to amy@targetcoding.com. That's AMY at targetcoding.com. She'll send you this form. Also, the Hipaa notice. This one is a very important notice. It's actually, it helps you as the provider, I think, more than the patient. So it's a good form, gives out the patient's rights. You know, patients can pay in cash, pay in full for the service, and you don't have to bill insurance if they want to invoke their HIPAA rights. That's on the form. If you have an open room, mention, we utilize an open therapy room. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room. That's at the bottom of the form, so you could customize this. Make sure you have the effective date of notice, and then the sign-off page by the patient. So we're going to offer everyone that assignment and authorization form and this notice of privacy practices. Those are the only two forms we're going to be, I think we're going to be offering during this this webinar. All right, next, after you fill out the forms, staff verification, insurance verification. If you can get a staff person willing to call insurance companies and do a verification, that's great. So these are the items you want to verify: exams, diagnostic tests, modalities, procedures, adjustments, obviously, manipulation codes, and there's, if you do taping and orthotics and back braces, this is our insurance verification form. Next, financial report of findings. Now we got to get busy talking about money to patients. This could be a make or break thing. You know that this could be the make or break situation, right? On a report of findings, you're telling the patient what's wrong with them. They're on board. They understand. You're telling them that you could help them. They're there to get help. You're telling them how long it's going to take, 3 times a week for how many weeks. And that fourth item, how much it's going to cost. The first 3 were simple. Most patients are on board. When you get to money, that's where things can change. So talking to patients, keep your fee simple. Fee confusion is one of the most common reasons for patients to complain about state boards. You see, if a patient comes to your office and they have to wait an extra 20 minutes to see the doctor, they're probably not going to file a complaint with the board. If your front desk assistant is not being friendly and rude to a patient, their patient is probably not going to report you to the board. But you mess with their money, you overcharge them, or they think you're ripping off their insurance company, they will call the board. Some providers give discounts without advising patients of the normal fees. In the industry, we call that sticker shock. Patient comes in, they're paying cash, they don't know your normal fees. Then they're in an accident or they get a job and have insurance. Now you're billing your normal fees? You didn't tell the patient? Problem. Patient education, more important than ever before. You have to address what's covered versus what's not covered, what's medically necessary versus wellness maintenance. Patients call their insurance and they're told, well, you're covered for 30 visits. The patient should be told that's up to 30 visits, and as long as it's medically necessary. So you have medically necessary care. You have wellness maintenance care. How do you handle this? Actually, what is medical necessity? What is medical necessity? When I speak to my clients, they go, Marty, the patient needs an adjustment. Okay, so for those doctors, medical necessity is the patient has a subluxation. Does insurance pay for that? Probably not just for a subluxation. Cash, no problem. So what is medical necessity? Medicare has a definition of medical necessity. It depends who you ask. Look, ask Aetna. Here's Aetna's policy on chiropractic. So Aetna covers chiropractic. Services are medically necessary when all of the criteria are met. Patient has a neuromusculoskeletal condition. Its treatment is clearly documented. The patient is improving within 2 weeks. So this is what Aetna says about chiropractic and what's medically necessary and what is not medically necessary. So again, depends who you ask. Now, what's maintenance care? What's wellness care? In my opinion, I can give you my opinion, but I'd rather you go right to the source. What sources do you have as far as defining what maintenance care is, right? What's maintenance care? What's wellness care? Depends who you ask. Let's ask Medicare. According to Medicare, chiropractic maintenance care includes services that seek to prevent disease, promote health, prolong and enhance the quality of life, maintain or prevent deterioration of a chronic condition. Use that. If you don't have a reliable resource, a nationwide or state, local resource that's reliable, incredible, if you don't have one, use this one. Patients always have questions about deductibles and copays and coinsurance. And nowadays there are some plans with these huge deductibles. How do you handle that? Some patients go, well, if your cash fee is less than my copay, right? So deductibles, that's the amount that the patient has to pay prior to the insurance company kicking in. Coinsurance is typically a percentage. So example, your fee is $150. The patient has a 70-30 plan. That means they're responsible for 30%. In that case, it would be $45. Copay is a flat fee. You could have the same fee, $150, but the copay is $25. That's all the patient needs to pay, right? Because you're in network with a contract. The difference between the copay plus the insurance amount and your total bill must be written off. Can't waive copays. Oh, routine waiver of copays, deductibles, coinsurance. Can't do that. It results in a false claim. I'm going to show you an interesting article recently that came out regarding a chiropractor that violated the false claims statute. Shocking what happened to him. So a carrier may consider a provider to be misstating the actual charge. For example, you charge $100, but you tell the patient, I'll accept the $80. No, that's not the way it goes. So here, I've broken down, based on 14 years of experience assisting chiropractors with maximizing reimbursement, I have broken down every man, woman, and child that comes into your practice can be put in one of these 7 financial categories. You name a patient, you could put him in one of these categories. Cash, in-network, out-of-network, Medicare, PI, work comp, discount medical plan organizations, and health savings accounts. So let's start with the cash. Patients come in, your fee is $100 a visit. I have plenty of doctors. I have a doctor that's opening up his 3rd office. He's all cash. He does advanced neurological work. He's not just a standard typical chiropractor treating musculoskeletal pain. He does a few things that are very unique, some brain-based care. He charges about $150 a visit. It's all cash. Patients come in, they pay $150, they leave. Next visit they come in, they pay $150, that's his fee, pay as you go. Very simple, nice, right? Very nice. Now, some of you offer discounts. Your normal fee is $100, but you have patients coming in that don't have insurance, or they have huge deductibles, and you want to give them I call it a prompt pay discount. The industry is going towards prompt pay discount versus time of service. To me, time of service fee is old language. It's not really used that much. Administrative fee discount, I don't really recommend those terms anymore. It's prompt pay. There's rules on it. There's opinions on prompt pay discount and how it works, how it doesn't work. So your normal fee is $100, and you say to a patient, well, I can give you a prompt pay discount because we're not going to be submitting any claims or doing any paperwork. We could take 10% off or 20% off. So that's fine. It's designed to reduce the cost of debt collection. It's not based on the patient's condition. You can't advertise it. It should only be offered at the financial report of findings, and there was an opinion on it. Here's the opinion right from the OIG. If you want this opinion, let us know. Send an email to amy@targetcoding.com. And as far as free care goes, there's the $75 rule. Anybody ever hear of this? This is what it's called in the industry, the $75 rule, which means you want to give away a free service. Well, there's an opinion from the OIG. The OIG says, you want to give a patient a gift? Okay, yeah. The value can't be more than $15 per incident, total of $75 for the year per patient. So, Mr. Jones, I heard you referred a patient to my practice. I want to thank you for referring a patient to my practice. Here's a gift. It could be, well, it can't be more than, value of $15. Movie tickets, a water bottle, a t-shirt. That's fine. Now look at this problem. This doctor, this chiropractor from Iowa, has agreed to pay $79,919. He's agreed to pay this huge fine to resolve allegations he violated the False Claims Act by improperly billing Medicare for chiropractic adjustments after providing free electrical stim to patients to influence those patients to receive chiropractic adjustments. Wow, this should get your attention. I don't know how the OIG found out. I don't know how the Attorney General of the state of Iowa found out that this doctor was doing it. I don't know the doctor. I don't know what he was doing. But somehow, some way, the U.S. Attorney General's office found out about this. They investigated him, and they fined him nearly $80,000 because he was giving free electrical stim to his Medicare patients. Don't give away things for free is my recommendation. Now, prepaid plans, terrific. You have prompt pay, which could qualify a patient for a little bit of a discount. Now, you offer the patient the opportunity to prepay multiple visits in advance. Fantastic. They can get another little discount on top of that. Be careful with that. Check with your state board to see if prepays are allowed in your state. Some states have a max on how much you could prepay. Some states require you to put the money in a separate account and withdraw the funds as the services are being done. Now, there are some states that allow direct pay. We'll get into that a little bit later. And then, yeah, here's another situation with a cash patient. They just say, doc, I just can't afford the services. Work out a plan, or maybe you'll give away a service for free, but it should be done sparingly. If a patient comes in and says, I have no insurance at all, I am totally bare, not, oh, I have insurance, it just doesn't cover chiropractic. If the patient says, I have no insurance at all, you could work out an arrangement to give away the services for free, but again, it should be done rarely and sparingly, and the patient should sign a hardship form. In-network, yeah, you know the deal with in-network. Well, most of you should know you're bound to a fee schedule. You could charge your normal fee, but you have to write off the difference between what you charge and what the allowed amount is, which could be pretty high. You're bound by a fee schedule. You can charge for services that are considered not covered in the plan. Charge your normal fees. Out of network, so back to in-network, you're just going to collect your copay. Yeah, and sometimes the copay is higher than your cash fee. Out of network, there's very few rules out of network. Basically, you could charge your full normal fee. You could have the patient pay you your full normal fee. Now, some of you that are out of network, you still accept assignment. That's fine. Some of you are out of network, and the plan that you're billing requires the checks to go to the patient because you're out of network. So just make sure you have all these categories figured out. Your front desk receptionist, financial manager, billing, insurance officer, compliance officer should have every one of these systems down pat. Every one of those 7 categories. Your office manager should know what to do without blinking an eye. That's what we do, is we train our clients. Whenever we go to an office or train an office over the phone, we get them to become 10th degree black belts in every one of these categories, so nothing slips by. Most of you have accounts receivables that are bloated. You have claims that have gone out, and they're either not getting processed at all, or they're coming back with all these weird denials, and your staff doesn't know what to do, and these piles get higher and higher and higher and higher, and by the time you get to some of them, you've passed the timely filing requirement, So you want to be a master at every one of these categories. Medicare, yeah, I have to give you a quick Q&A. This will cause you, some of you to be, what? I didn't know that, because every time I talk about this, I get that reaction. Can you treat Medicare patients without being enrolled in the Medicare program? The answer is absolutely not. You can't say to a patient, I'm not in Medicare, don't worry about it, just come in and pay me cash. I'm not in Medicare, I don't bill Medicare, I don't deal with Medicare, just come in, Mr. Jones, and pay me cash, and we're not going to bill Medicare. That's illegal. Don't do that. You must be enrolled, formally enrolled in the Medicare program in order to see Medicare patients. If you're not formally enrolled in the Medicare program, then just stop seeing Medicare patients. It's very simple. In my opinion, it's black and white, very simple. If you're not enrolled in the Medicare program, do not see Medicare patients. But then this is what I hear. But, Dr. Kotler, we want to see Medicare patients. We just don't want to bill Medicare. Well then, either get enrolled and bill Medicare, or don't see Medicare patients. Chiropractors cannot opt out. There's a difference between opting out and being non-par. Chiropractors cannot opt out. Even if here's another thing. I hear some chiropractors say, well, yeah, I'm not in Medicare. I don't bill Medicare. I just have patients sign the ABN form, and I just, take cash. Absolutely incorrect, illegal. Actually, Medicare says the ABN form belongs to us, belongs to CMS Medicare. If you're not enrolled, formally enrolled in the Medicare program and billing Medicare for covered services, you're not allowed to use the ABN form. There's the information on your screen, and just to clarify it, this is right from Medicare, bottom right corner. Chiropractors may not opt out of Medicare, noting that opting out and being non-par are not the same things. Chiropractors may decide to be par or non-par with Medicare, but they may not opt out. So hopefully I clarified that. Then we have PI and work comp. Now the rules, laws, regulations are different in every state. Some states with PI, well, most states with PI, you have to send the claims and the bills in together. There's a fee schedule. Some states, the work comp fee schedule is the same as the PI. Some it's not. Work comp, you may have to fill out certain forms. You may have to get the care pre-authorized for certain services. So check with your state board on billing for PI. I can tell you with work comp, you're not allowed to collect money. I don't know any state that allows providers to collect money from patients that have been hurt on the job. No collection of money for that condition. Now, if the patient says, I got hurt on the job and I hurt my lower back, but now the patient says, I was playing tennis and I hurt my shoulder, had nothing to do with the work comp injury, then yeah, you could treat the patient's shoulder and bill their regular insurance. PI, you could collect cash if you don't want to accept assignment. Most states allow providers to take money from PI patients, but that's not practical because if the attorney finds out, they'll probably say, go somewhere else. Then we have discount medical plan organizations. The one I like best is Chiro Health USA. Here's why it's so terrific. Your normal fee, let's say, is $150 to insurance and PI. Now a patient comes in, you want to do the same thing and charge $30. Well, you can't do that unless you're part of a discount medical plan organization. So that's where Chiro Health USA comes in. It gets around that dual fee schedule situation, so I would recommend you contact them if you're interested in a DMPO. There's a few out there, but I think Chiro Health USA is the best. They support the profession more than any other group that does DMPOs. Next, health savings accounts, health retirement accounts. I only have one provider that's in network with one of these plans. So typically, patient just pays cash and give them a walkout receipt. Try to give them the walkout receipt without codes. That would be better. And then you should have good financial policies, strong financial policies. It tells the patient approximately what you're going to charge and why you need to charge and what they need to do and what you need to do and how they could prepay and what your estimated charges are. So have a good financial policy. Have a billing and coding policy manual. I have a little, I call it the 35% rule. If you're billing If you're collecting more than 35% from one particular insurance company, you should have a billing and coding policy manual set up just for that particular plan and explain what you do and why you do it. If that company comes knocking on your door, you're going to be in good shape. Now with Medicare and the OIG, Office of Inspector General, they want providers to be proactive to prevent problems because there's a lot of scamming that goes on with federally funded programs. So the OIG looks at providers that get paid by Medicare, Medicaid, TRICARE, federally funded programs to see if there's any wrongdoing going on. And OIG has found a couple of problems with the chiropractic profession and the physical therapy profession, so they want doctors to be proactive. What does that mean? Create a policy manual which uses these 7 essentials. The 3 that are in bold are the main 3, in my opinion. Doing internal reviews. We show our docs how to do internal reviews. We have a little spreadsheet that it's an open book test. And you score yourself. So do that. Have regular staff trainings and document them. How do you prove that you had a staff training? Take out a spreadsheet, simple spreadsheet, document who was there, what the topic was. If you're going to hire a chiropractor, let's say your practice is getting really busy. You want to hire a chiropractor to treat your Medicare patients or all your patients, including Medicare patients. Do not hire that chiropractor until you put his or her name into the Medicare exclusions list. If their name pops up, you cannot hire that doctor. If you hire that doctor and Medicare finds out, big problems. You'd have to give all the money back. Stark law you should be aware of. Can't send patients to another facility that you have ownership in for designated health services. Anti-Kickback you should be aware of. Means you can't get paid. Can't pay someone to send you new patients. Like if an attorney says, hey, I'll send you a patient, give me $300 for every patient I send you. Or you go to a body shop and you go, hey, patients that come in that are in car accidents, if you get them to come to my office, I'll give you $500 for every patient. You see, that's not good. That's anti-kickback. Hipaa you should be aware of. It's been around a while, over 20 years. Hipaa applies to covered entities. Are you a covered entity? Well, if you bill or receive payment from an insurance company, you are. If you submit claims electronically, you are. So just a quick Hipaa summary. Do a security risk assessment. If the Hipaa police came knocking on your door, it's one of the first things they would ask to see. Could we see your security risk assessment? If you don't have one, you don't have a Hipaa compliance program. Even if you have Hipaa notice, you talk quietly, you have passwords and antivirus software, it's not enough. If somebody says, could we see your security risk assessment? Have policies, procedures. If you'd like to put together a Hipaa program, here's a great link. If you'd like to do it on your own, here's how you could do a security risk assessment on your own. All right, so let me just finish with a 9-step action plan. Get proactive. Before you go in, that's step 1. Step 2, before you go in to see a new patient, review all their paperwork before you go in there. Step 3, make sure the patient signed all the forms, your health history review systems, financial policies, informed consent, Hipaa notice. Step 4, review the policies from the insurance companies that you bill the most. If you bill Cigna, I have one client, he has a large building next to him. Bank of America is next to his office. There are 400 people that work in this building. They all have Cigna. He has tons of patients coming into his practice from this one particular insurance company. So I train him on Cigna's policy on chiropractic. There are a few important things. I've given you a couple of things here regarding medical necessity. There's probably another 30 things you should be aware of. One of the things I'll give you right now with Cigna is they want to see improvement after 2 weeks. Your notes have to show improvement after 2 weeks of care. Otherwise, they can consider the care not medically necessary. So that's what step 4 is about. Step 5, understand the what and the why. Your CPT codes are what you're doing. Your ICD-10 codes are why you're doing it. Make sure they link, they combine, they're compatible. For example, you're going to get audited. If you're billing 97110 and your patient is not displaying any functional deficit like decreased range of motion, you're going to have to give the money back. Step 6, do a self-test on your SOAP notes. Make sure you know what to look for per insurance company. Give you an example. Medicare documentation requirements are very specific. They want to know if you did a system review was relevant. They want to know how the patient was doing since the last visit. Cigna doesn't require that. Aetna has different requirements. PI obviously has different requirements. Step 7. Find out what a medically necessary SOAP note looks like and try and duplicate it into your practice. Find out what an insurance company billing compliance plan looks like and implement that as soon as possible. Insurance companies, they know recouping money is profitable. One expert in the industry, a fraud and abuse expert, told me that every dollar that a health plan spends on an audit, they recoup 14 to 17. Step 8, put together a simple billing policy manual that explains what you do. Write your own book. For example, in my practice and many of my clients, they adjust full spine. My activator clients, they adjust full spine. But they're only billing for the, it could be billing 98940. Why? That could look like downcoding. Also, if you're billing auto insurance $250 a visit, and you charge cash patients only $50, doesn't make sense. And step 9, conduct regular staff meetings, especially with the staff members that do your billing, especially to the insurance companies that pay you the most money. Also, if you use a billing company, please do a spot check. 2 recent cases came across my desk. Billing companies adding modifiers, adding services that were not authorized by the doctor, and the doctor didn't even know until the insurance company came knocking on the door. Do a spot check on your billing company, just in case you get that knock on the door, right? Do this so you could SWAN. That's one of my favorite acronyms. SWAN, which means sleep well at night. And here, I want to show you this viewpoint. When you look out into the waiting room, you're the doctor, right? You look out into the waiting room, this is what you should be thinking. Oh, there's patient 1. I might not even know her name, but I know she gets headaches. Oh, there's Joe. He's got rotator cuff syndrome. You should be looking at the patients from a healthcare standpoint. You should be looking at them. Oh, yeah, there's Jennifer. She's got knee bursitis. There's Andrea. She's got a herniated disc. I got to help these people. That's what your viewpoint should be. Front desk assistants, billing managers, this is what you should be thinking. Oh, yeah, there's Jennifer. She's got to pay her $50 copay today. Oh, there's Joe. I got to get an ABN signed from him. Oh, there's Anita. Anita's coming in. Her credit card expiration date. Oh, it expired. I got to get a new credit card. Your front desk assistants, your billing managers, your office managers have to be pit bulls to maximize reimbursement. You deserve to get paid. Why should you get paid for everything you do? That's a common question I ask doctors when I train them. Why should you get paid for everything you do? And many doctors go, and they have difficulty giving me an answer. The answer is, it's because you deserve to get paid for everything you do. So just a few closing comments. Check with all the plans prior to billing. Make sure it's compliant. Thank you for attending. Here's my direct email, drkotler@targetcoding.com. Here's the website, telephone number, HIPAA secure fax number. You're going to send us patient files. Don't attach it in a Gmail. Upload it to our HIPAA secure portal. We're on all social media platforms. Follow us on Instagram and Twitter. Like us on Facebook. check out the YouTube channel. We have tons of free videos there. And besides these webinars, we do seminars. We do on-site consulting. We sell videos. We have 14 videos. We have membership programs ranging from $99 a month up to $599 a month. We have integrated membership programs. We have hourly consulting. You can call us and just hire us for 1 hour if you would like. We help doctors with Hipaa compliance programs, Medicare compliance plans. We have a forms, logs, and templates package that we sell. These are chiropractic, physical therapy, acupuncture, Medicare, and Hipaa forms. Over 75 forms, logs, templates, and we break them down. There's a bunch of new patient forms, financial administrative forms, exams and treatment plans. We have 10 sample soap notes, letters of medical necessity, appeals. We have PT forms, acupuncture forms, Medicare forms, and 23 Hipaa forms. Let us know if you're interested in that. Here's the table of contents for our forms package. We also sell a book. This is our most popular book that we sell. It's the book on the best chiropractic ICD-10 and CPT codes to improve reimbursement. This is one of the best parts of the book. Let's say you diagnose a patient with, let's say, cervical radiculopathy, and now your question, so Dr. Kotler, how did you come up with that? Hopefully you'll say, well, patient had pain radiating into the arm, and there's a couple of ortho neurochiro tests you should do. Some FAQs, other pages of the book that shows you how to pair your codes, and it shows you the codes that pay for the most visits. We have some cheat sheets in the book. Here's our product order form for our videos and our compliance manuals. Even if you don't see Medicare patients, you should have a billing and coding compliance manual. We sell them to acupuncturists. Acupuncture audits are on the increase. Careful, if you're getting paid $100 to $200 a visit for your acupuncture visits, make sure you are documenting those services properly. Acupuncture codes are 15 minutes. They're not 8 to 22 for 1 unit. Different time-based situation. And here's our Medicare compliance manual. Hipaa is based on how many employees. The fee is based on how many employees you have. So up to 10 employees, you get a comprehensive security risk analysis with detailed report, cloud-based storage portal. You get an actual hard copy binder with all the forms, all the digital files for all the forms, all the policies. We have about 25 videos staff can watch on Hipaa. They could take a little test and print out a certificate so you could prove that you're doing your best to be Hipaa compliant. If anybody comes snooping around, we help you with your business associates. The Hipaa program also includes our Medicare OIG program. We have a basic membership. This is a membership where send in unlimited questions, access to our live webinars. Like later today, we're doing a live webinar. It's not free, but if you're a member, it's free. Non-members, it's $149. It's a 2-hour webinar on chiropractic soap notes. It's approved for CE credits in about 30 states. If you're a member, that's included. Plus, you get discounts on our videos, unlimited question and answer. It's only $99 a month. And you pay as you go. There's no contract with this one. We have a seminar coming up. Couple of other webinars on PT and acupuncture. So again, I want to thank everybody for attending. Again, here's my contact information, Dr. Kotler at targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Our Hipaa Secure fax number is 1-844-831-2347. I hope everybody learned a lot today.